Good evening and a warm welcome to our International Nurses Day webinar 2026, themed Empowered Nurses Saves Lives, hosted by Nurseslabs. Thank you to one and all for being here today. Towards the end of this webinar, we will be having an award ceremony for this year's International Nurses Day competitions that were held throughout the last week of April and the first week of May. Stay tuned to the end to watch the winners being felicitated as well as the unveiling of the Nurses Day theme song. I am now honored to welcome our first speaker, Dr. Jessie Jacob, Principal of Narayana Hridyalaya College of Nursing, Bangalore. With over 26 years of experience in the clinical and educational field, ma'am has a vast knowledge in bringing out the excellent skill of students as well as faculty. Ma'am has completed her PhD from National Consortium of PhD Nursing under the INC, MSc from Sri Ramakrishna College of Nursing, Coimbatore, and her post BSc Nursing from Manipal College of Nursing in Manipal. Her academic and professional achievements include several research paper publications in reputed national and international journals and has contributed to so many chapters in the nursing textbooks. Her administrative and leadership roles include presiding as an officer for the POSH committee at Narayana Hridyalaya Foundations. Ma'am is a recognized postgraduate guide and an undergraduate examiner by the RGUHS. Dr. Jessie holds a professional membership of the Trained Nurses Association of India and the Nursing Research Society of India. We are honored to have you here today with us, ma'am. Over to you.
Yeah, thank you so much. First of all, I would like to thank the Nurseslab and the team for giving me this opportunity. A very good evening to one and all present here. So once again, good evening to one and all. My topic for today's presentation is saving lives through empowered nursing practice. A nurse may not remember every patient's name, but every patient remember how a nurse made them feel during their vulnerable moments. So many lives are not saved only because of advanced technology or treatment, but because a nurse acted quickly. So our nurses, our future empowered nurses saves lives is the theme of International Nurses Day 2026. So what is nursing empowerment? Nursing empowerment is the process of fostering autonomy, competence, and decision-making authority in nurses to improve patient outcomes, job satisfaction, and organizational efficiency. Now, let us see a few the nurses who are empowered. Florence Nightingale, who is the founder of modern nursing, during the Crimean War, many soldiers died due to infection. The main reason was poor sanitation. She improved sanitation and reduced the infection rate from 40% to 2%. So she analyzed the situation and found that sanitation is the main reason for the infection, and infection is the main reason for death. So she just did the basic things like improved the ventilation, improved the hygiene, and because of that, the situation improved. Anjali Kulate, I think many might have heard this name. During the 2008 Mumbai terror attack, she moved 20 pregnant women and staff members to a pantry for protection. So her bravery saved 20 pregnant women and their unborn infants. So the empowerment here, what she has shown is leadership, courage, decision making, and patient advocacy. Claire Bertsinger, during famine in Ethiopia, she worked in famine affected areas of Ethiopia and raised awareness about starvation and poor health conditions. So, here, what empowerment she has shown is advocacy, humanitarian service, and public awareness. Mary Elisa Mahoney. So she became one of the first professionally trained black nurse and fought against discrimination in healthcare. So the empowerment, what she's shown is equality, professional advancement, and social justice. Lini Puducherry, a nurse from Kerala who cared for patients during the Nipah virus infection outbreak despite personal risk. The empowerment, what she's shown is dedication, compassion, and professional responsibility. ICU nurses, many times they recognize or identify early signs of sepsis before the doctors arrive, leading to rapid treatment and saving lives. Because nurses are the one who are being with the patient the 24 hours. So the empowerment, what they are showing is clinical judgment, autonomy, and critical thinking. Community health nurses, vaccination drives. So community nurses in rural areas educate families, administer vaccines, and prevent disease outbreaks. So here also the empowerment, what they are showing is health education, prevention, and community leadership. So, nurse leaders and policy making. Senior nurses contributed to hospital policies, infection control committees, and national healthcare planning. So, the empowerment, what they are showing here is decision making, administration, and leadership. So, though we have few nurses like this who are empowered, many more nurses to come forward, and or many nurses we have to make empowered, then only the healthcare can be improved. So, the key qualities for empowerment are leadership, confidence in decision making, critical thinking, communication skills, patient advocacy, clinical competence, a team collaboration, compassion, and courage. So, what are some of the strategies to improve the nursing empowerment? Ensure staff ratios, safe staffing ratios. So, inadequate staffing leads to stress and the workload of the staff nurses. So, we must ensure safe staffing ratios. Ensure job satisfaction and retention. So, as we all know, compared to many other professions, though the nurses are one of the hardworking professionals, their salaries are less when compared to the other professionals. So, to empower them, fair salaries, timely promotion, and recognition need to be given. Improve working conditions. So, we must give adequate rest for them, welfare activities to be planned, and adequate resources and a strict policy to prevent violence against them need to be implemented. Support mental health. So, the counseling, stress management programs, and mental wellness initiatives must be initiated to support their mental health so that their burnout can be reduced. So here there are other few strategies. Invest in nursing education and training. So I must say the education must start in the college and school itself because today's nurses are the future nurses. So we must equip them or we must train them to get adequate knowledge and skill so that they will be competent nurses. So once they are competent enough to do their duty, so it will naturally empower them. And we must not stop with that, just making them competent enough. We need to again encourage continuous education and skill development for the staff nurses through workshops, certification, and specialized training. And also increase nurse participation in decision making. See, as we all are aware, in many hospitals, nurses are not involved in hospital policy making or healthcare planning. So the scenario need to change to empower them, we must give them a place in policy making committee or in healthcare planning committee. So promote respect and recognition for nurses. So when any calamities or any epidemic or outbreak is there, so we all will clap for the nurses. But we must not stop with that, and see, we need to continuously respect and recognize the nurses. So we must give the leadership opportunities, the opportunity to for learn, and also we must award and appreciate their hard work. In clinical in clinical setting, how we can empower nurses. So early detection of patient deterioration, so any changes in the vital signs, any breathing difficulty, altered consciousness, decreased oxygen saturation, etc., the nurses need to identify, and it need to be addressed properly, and timely intervention such as oxygen therapy or administering medicine or initiating CPR, controlling bleeding, or whatever the necessary one we should be able to do. So we should not wait for that. We should be able to identify early, and what you need to take the actions. See, for example, if you are taking a ECG, we are noting an ST segment elevation. So we must know that it is for suspecting a myocardial infarction, and it need to be reported, and time matters. And also continuous monitoring of care need to be done, and also wherever required, we need to advocate for the patient, like protect the patient's right, ensure informed consent, and maintain patient dignity, communicate patients' need to doctors and family members, and speak up when their safety is at risk. So ethics we need to follow. So what are some of the barriers for the empowerment? One is lack of knowledge and skill. As I said earlier, so knowledge is the power. So each nurse should have enough knowledge and skill so that they will have the natural confidence, and the power will be there in them to communicate and speak up. So sometimes lack of knowledge and skill will be one of the reason for the lack of empowerment, and poor communication skill. So if the see, sometimes we may know the things, but if we don't have enough communication skill, we may not be able to convey the same thing. So it will leads to lack of empowerment. Another one is lack of autonomy. Autonomy in the sense like limited authority in clinical decision making. So Nurse Practice Act and all, no, like it is not fully implemented in India. So what nurses can be done, what they should not do. So that clear cut line should be there, and what they are entitled to do should permit them to do. So that decision making skill we need to empower. Sometimes lack of this one staff shortages and limited access to training. See, what we learned in 1995, a lot of changes are there. So upgradation should be there. So what are the advantages? See, for nurses, increased confidence will be there if you are empowering them. Job satisfaction will be there, and reduced stress and burnout will be there. For patients, if we consider, improved safety will be there, better communication, and a higher quality of care will be there through empowered nurses. And if we consider for organizations, increased staff retention, lower turnover costs, and improved organizational efficiency. Let me conclude the topic. Not every life that is lost in a hospital is not because of the disease. Sometimes it is because a warning sign was missed. So an empowered nurse are not just caregivers, they are the lifesavers, leaders, and innovators. So we must invest in nurses and save lives. Thank you.
Thank you, Dr. Jessie, for that extensive and informative message on saving lives through empowered nursing practices. It was a very thought provoking message for all of us as nurses. Thank you for taking your time off your busy schedule to be here with us today and to share your knowledge and expertise. We will now move on to the next. Second speaker for this evening, for which I have the honor of welcoming, is Dr. U.N. Dhandargi, Principal, BES College, Bagalkot College of Nursing. With over 20 years of teaching experience for BSc, post basic BSc nursing, and MSc nursing courses in BBV Sangha's Sajalashri Institute of Nursing Sciences, Bagalkot, Sir has over 33 publications in indexed and national international journals. Sir is also a resource person for 14 national and international continuing nursing programs across India. We are honored to have you here with us today, sir, and over to you.
Thank you, ma'am. Good evening, everyone. It was a wonderful presentation from Jessie, ma'am. Ma'am has already told what is empowerment and how important it is the nurses to be empowered in today's era. So I thank Nurseslab for giving me this opportunity, and they have taken a wonderful step because this is indeed a need of our in today's era for empowerment of nurses and spread this word all over in every area where nurses are working. So it is said that the nursing theme says empower nurses save lives. So only working as a nurse is not sufficient. A nurse must be empowered. Then only the nurse will be able to fulfill their duty of saving lives. My topic for this session is empowered to lead. So how nurses can be empowered to be a leader. Nursing is transforming healthcare system. So how nurses can be empowered to such a level that they can bring changes in healthcare system. We know that we are group of a large team. We are part of a large team, but still, how much is our role in taking major decisions in transforming the system, whole system itself? Are we just part of the system as passive workers, or are we the decision makers? So my objective for this session, or at the end of session, the participant should be able to understand the concept of empowerment. Jessie ma'am has already told what is empowerment. List various strategies for empowerment of nurses, where the advancement in nursing profession before and now, and key aspects of empowerment of nursing leadership. So basically, what is empowerment? As already discussed, empowerment is the process of gaining three aspects. When do we say a person is empowered? Let us come out of nursing. Any person can, when can we say the person is empowered? The first and foremost is freedom. The person must have freedom in their work. Being nurses, are we able to take our own decisions? Do we have freedom for that? That is a big question. And second one is authority. What is authority? In simple words, authority is to take decisions independently. Not being a passive worker, if you are able to take any of our decisions independently, then that is the authority given to us. And whatever knowledge we gain during our training period, our learning period, whatever knowledge we gain, if we are able to act on that knowledge, then we have freedom. And the most important part of being empowered is to have confidence. Now, how many nurses function confidently? As per a research study among nurses, it was found that 70% of the nurses who participate in that study, 70% showed low level of confidence. Now, this confidence I doesn't mean in their daily work. Nurses are so overburdened that they do their work perfectly. But where is this low level of confidence seen? The low level of confidence was seen in decision making. Many nurses have been found very good in completion of tasks. So, whatever task they are given, passively, confidently, they will complete that task. But they were seen short of confidence in decision making, in taking autonomy. Ma'am was talking about autonomy. It is autonomy. When we are able to take responsibility of our own actions, then that will be autonomy. When you are given authority and you take responsibility of whatever acts you do, that is autonomy. So in that autonomy and decision making, the confidence was seen low. But now, if you see the present era, there has been a drastic difference among nurses, and the process of empowerment is going on. So if we see what is our strength in what is our proportion, what is the percentage of nurses in workforce in overall world, the global healthcare workforce, in that 56% are nurses. And if you see in India, 53% of the healthcare workers are nurses. So we can say majority of global health workforce are nurses only. But recently you would have seen elections and all. Now, whichever party gets the majority of votes, now they have the authority of forming the government and taking all the decisions. But the question is, we are almost more than 50% of the workforce. Do we have the authority to take decisions, to make changes in the system? And I hope most of you will agree with me that no, we do not have. So, what is dragging us? The question is, do we have contribution in policy making? Do we form we policies? So many policies are made any health professionals, especially nurses. But do nurses have role in policy making? The answer is very, very low. How many nurses contribute in decision making? Okay, patient care, any medicine has to be given, any care has to be given, the patient has to be discharged, admitted, transferred. How many, what percent of contribution is taken from nurses in any of these decision making? Okay, or any changes in the structural format of the hospital or the ward, or any changes of a purchase of new machinery? How much contribution is taken from nurses? So how good are nurses as leader? Okay, the answer is, we should understand that quality is important than quantity. Though we are higher in quantity, we are more than 50%, but do we have that quality which will put us in that position of decision making? Okay, just take an example. There are thousands of people on one side. A war is going on between two groups. Okay, there are thousands of people on one side, and there are hardly 4 or 5 people on the other side. If I ask you who has more strength, you'll obviously say the thousands of people standing on one side have a lot of strength. But if I say in other aspect, these 4 people who are standing on the other side are armed and they are full of guns and everything, and who has more strength? Does the thousands of people who are unarmed, who are standing bare hands, or these 4 people who are fully armed have enough arms that can kill these thousands of people? Obviously, the answer will be, though these people, the one group, the first group, they are more in numbers, but the second group who are armed, they are more strong compared to the thousands of people standing on other side. That's why quality is what matters than quantity. Though we are more than 50% of the workforce, it doesn't mean without good quality will be given the chance to take decisions. Empowerment of nurses. When can we say we are empowered? Imagine there is a group of healthcare workers who are providing care to a patient, and there are doctors, there are nurses, there are other technicians, there is a group standing. And if in that team, the one who is leading, a doctor, is doing something wrong, does the nurse have the authority, the confidence to tell that doctor, no, this step is wrong, you shouldn't do that, this is like this? If the nurse is able to tell a doctor, then the nurse is said to be empowered intellectually, confidently in their particular position. So, what are needed? What aspects of needed for empowerment of nurses? First and foremost is structural empowerment. What is structural empowerment? It is good training. Structural empowerment is when the nurses have access to information, when the nurses have access to support, and more importantly, when the nurses have access to resources, when there are enough opportunities for learning and professional growth in their work area, then we say there is a structural empowerment. The structure provided to the nurses should motivate them, should give them opportunity to enhance their skill. So this is needed. Structural empowerment is very necessary for empowerment of nurses. Second aspect is investment. Very, very important. Where to invest? Okay. Invest in education. As I was telling, quality is what matters than quantity. Investment is at the beginning stage only. The quality of education is what matters in investment. There must be investment in leadership. Leadership skills should be taught. There must be
The dashboard is still there. It is there.
There must be investment in workplace conditions that are supportive for preparation of nurse leaders. And more important, there must be safety and protection. There should be structural safety at the workplace, and there must be protection in the form of physical as well as psychological area. So safety and protection only doesn't mean physical support or psychological support. It also means how safe the nurses are at their work in terms of their safety of job, their safety of incentives, their safety of continuation of work. We have seen many a times whenever any mistakes happen in hospital, I have witnessed myself, if some mistakes happen, then it is so simple that the nurses are terminated. So is it, if with that conditions, will nurses be in a position to take strong decisions and take part in decision making? So safety and protection is very important while we think of empowering the nurses. So coming to the major part, empowering the nurses as leaders. So if we see leadership in nursing, there has been a change from dependency to independency. Nurses who were dependent, now they are working much more independently. The way of education we have, the way of opportunities we are given, from dependence to independence, there has been a growth. Why this growth is there? There have been many changes. If we compare before and now, in the area of education, there has been much change. Previously, nursing courses were just apprenticeship. That is just, they were a certificate course, a training course, a certified person can work as a passive worker and just do the work which has been told. Now it has changed to degree focus. There are graduation, post-graduation, there is fellowship, there is a PhD courses, then even there is post-PhD courses. There are many technical skill-oriented courses. So the education has been changed, and as we all know, the syllabus itself has been to build up competencies among nurses. And as I was telling about autonomy, previously we were dependent, now we are much independent. And focus, previously the focus of work was to be task oriented, like we had to complete certain task. But now the focus is on outcome oriented, not only task. As we practice more and more evidence based care, we think much, we deviated from medical diagnosis. We focus more on the problems as a nursing diagnosis, and we try to bring better outcomes among patients. And technology, obviously every field is dependent on technology. Previously the use of technology was minimal among nurses. Now with artificial intelligence and all, the technology is highly advanced. The key aspects of empowerment, particularly in way of leadership. So what is needed much, where which are the areas where the nurses have to be strengthened, the participation of nurses have to be increased so that they can perform as better leaders. It is surprising that most of the time, most of the courses, if we see, do not have a syllabus as much as do we have. Like for example, nursing administration or nursing management, what we learn a whole year now in one semester. So that teaches us all the principles, all the tactics to how to be a leader, how to be a good administrator. But still we see the people who don't learn during their course period, they are better administrators compared to nurses. There are several areas where nurses must take opportunities. So what I say is, see, nothing is given, we have to take. Now, what is lacking among nurses is the risk-oriented behavior. Nurses should come forward, take risks, and show their ability, show their skills, show their leadership ability. So first and foremost, the nurses should participate in shared governance and decision making. Very, very important. Governance is a part where all the policies are formed. Governance is a part where administration is done. Now, nurses should come in a position. See, again, I am telling, nothing will be given, must be taken with their own ability. So, nurses should participate in governance. Now, I am very happy to tell you that in our own university, if you see the condition some 10 years before, there were no Senate members from nursing fraternity. But now there are so many. There have been Mr. Somshekhar Kalmat, who started this tradition. And now after him, following, there are so many people working as Senate members and other leaders in our own Rajiv Gandhi University of Health Sciences. So this is what shows, if you keep and ask, nobody will give. And when you show your strength as a group, then governance will be taken automatically. And automatically, what is happening now? Now, most of the decisions taken by university are directed through these nursing senate members. Then second aspect is a professional development. Now, unless the professional develops, and being professionals, we do not develop, we cannot strengthen as being leaders. Now, what is professional development? Professional development occurs when there are more innovations in that profession, when there are more research works, more advancements in their profession. We see so many countries where research, innovation, the countries like Israel, where every fifth person is having some patent. Like nurses with such so much of education on research and statistics on other aspects, there must be so many patents, there must be so many innovations. But still we see that there are research works are there are more, but innovations are less. So for profession development, we should add more and more innovations. And transformational culture. What is this transformational culture? We should develop a culture in our work environment where there is a supportive culture, supporting for opportunities, supporting for development. There must be there must be intellectual stimulation. There must be push, that there must be tasks given which improve the intellectual ability of the nurses. There must be visionary leadership among nurses. I always say that nurses should behave proactively than reactively. Most of the nurses have the habit of acting, reacting, giving reaction whenever they are told something. But nurses should perform. To be a good leader, the nurses should perform, should work proactively. And there must be reduction in burnout. When we start performing proactively, obviously there will be less burnout among our work. And all to this, the transformational culture, the most important goal for this transformational culture is to improve the quality of care provided to the patients. The outcome, what we see, that must be totally of good quality. And as ma'am was saying, the major part where we lack in nursing is advocacy. Nurses should be with the ability of a front line. As we are well known in at the period of COVID-19, at the outbreak of COVID-19 about frontline workers, we should also be frontline advocates. We should be frontline advocates while training the novice nurses who are newly joined. They must be given equal opportunities to learn and become better. We should be having advocacy in converting the quantity into good quality. So empowering vulnerable population, standing or supporting for any vulnerable group is frontline advocacy. So these are some of the aspects where we should join, we should work to be good leaders. And last three areas which can influence the empowerment, they are representation. We should stand in every area, in every aspect, not only in the wards, not only in the area, but every area of administration, every area of decision making. There must be a person who is representing nursing profession. Then only the empowerment is possible. We should not depend on others for making decisions for us. We should be, the second aspect, very important, is we should be part of the uh, decision making part, the policy making part. So you all must have heard about Miss Nisha Mehta, who has been appointed as health minister in Nepal. Like this, it doesn't mean from which area we come. We all have got the similar ability. We have got the same intellectual property. Again, I tell you, where we lack is we lack in risk-taking behavior. We should stand. We should put ourselves in those areas where we can be good leaders. So that is most important. Leadership roles, taking responsibility, autonomy. Autonomy doesn't mean you should be given authority. Autonomy means when I stand for my acts. So whenever I do certain activity, it is the outcome is good or bad. Some people, what they do being leader, when the outcome is good, they take the credit. But when the outcome is bad, the responsibility is passed on either to subordinates or any other area. That is not autonomy. Autonomy is when either or the outcome is good or bad. You should take the risk of taking the decision. Whatever it is, you should be able to take responsibility of the acts you have done. Then it is true leadership. So these aspects we have to develop among ourselves. And as I said, with this, what we should do is we should try to be hero. We should not behave like a victim. We do not say this was forced on us, this was done to us, our working hours face shame. How much decisions we are taking? We do so many things. How much decisions are we taking for our own things in our the timing of our work, the even what facilities are provided? Are we taking any decisions in them? Unless we put ourselves in these areas, unless we take autonomy, unless we take responsibility, unless we develop professionally, we cannot become good leaders. And these all aspects are needed to become good leaders. We see empowerment has in lot of areas like community health officers, I say they are empowered where there are standing orders, where they are given the authority to administer many of the medications, deal with the patients independently. That is a sign of empowerment. Our many of the nurses are at higher positions and taking decisions for many healthcare policies. That is our empowerment. But being in such a majority, we still are lacking. We still have to develop in a lot of areas. I am just given 30 minutes. That's what I could present in this part. Thank you.
Thank you, Dr. U.N. Dhandarki, for your insights on the topic. It has invoked a sense of dignity and pride in all nurses present here today. We will now move on to the third speaker of this evening. It is my privilege to introduce our third speaker for this evening, Dr. Shima Mansoor Mohammed, who will be speaking on the topic of digital healthcare. Dr. Shima is an assistant professor of pediatric nursing at the University of Bisha in Saudi Arabia. She holds a doctorate in nursing science and has extensive academic and administrative experience, including leadership roles in quality development and nursing education. Her research focuses on pediatric nursing, patient safety, and nursing education. She has published widely in peer-reviewed journals and has participated as a speaker and a resource person in several international conferences. We are honored to have you with us here today, ma'am. Over to you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening for everyone. Thank you very much for your kind invitation and for this kind introduction. Thanks. It is truly an honor to be a part of this special occasion where we are celebrating the International Nurses Day. And also it is an honor for me to join such a distinguished group of professionals and colleagues from around the world. We are, as nurses, are not only caregivers, but we are contributors to knowledge, advocates for our patients, and key driver of change within healthcare system. Even like this today, provide us with an important platform to reflect and share and grow together, inshallah. Today, I am pleased to present my talk on the topic titled as Future Ready Nurses, Empowerment in a Digital Health Era. Inshallah, I will discuss in my presentation how nursing is evolving in response to digital transformation, the role of artificial intelligence in shaping nursing practice, also what is truly mean to prepare future-ready nurses in diverse healthcare contexts. Thanks again, and I hope my presentation for today will offer a valuable insight and contribute to our shared understanding and practice. And now let us start with my presentation. Future Ready Nurse Empowerment in a Digital Healthcare Era. My roadmap for today's presentation, as I mentioned in the content, will evolve role of the nurses in digital healthcare era, understanding the digital transformation and AI in nursing, the key competencies for future-ready nurses, challenges and ethical consideration, and strategies to empowerment and future direction. I will start with a changing landscape of healthcare. Healthcare is undergoing a major transformation driven by digital technologies, artificial intelligence, data systems, patient-centered innovations. As a nurse, we are central of this transformation, as they represent the largest group of healthcare professionals. This is stated by WHO in 2020. Digital health is no longer an optional addition to healthcare. It becomes an important part of everyday clinical practice. WHO stated that digital health should strengthen health system, improve access to care, and support universal health coverage when implemented through strong workforce development and ethical consideration. For nurses, this transformation is especially important. Why? Because nurses represent the largest group of healthcare professionals and are often the closest professional to the patients. Nurses document care, monitor patient change, educate patient, coordinate the multidisciplinary care, and also nurses respond to the early signs of deterioration. So this is central role become even more critical in the context of increasing workforce. With approximately 189,000 new nursing positions projected annually in United States only. This is according to BLS in 2023. A future-ready nurse is not simply a nurse who can use technology. Future-ready nurse is one who can combine clinical judgment, compensate care, ethical awareness, digital competence, and innovation to improve patient outcome in increasingly complex healthcare environment. Now we will shift to the concept of nurse empowerment in digital era. What does it mean? Nurse empowerment refers to the ability of the nurse to access to knowledge, access to resources, authority, confidence, and organizational support. It is very important. Needed to practice effectively and influence care decisions. Despite their central role, nurses are often underrepresented in decision making. Unfortunately, but this is a fact. Nurses are underrepresented in decision making related to digital innovation and healthcare technology implementation, and this also stated by WHO in 2020. In the digital era, empowerment also includes the ability to use digital tools critically, participate in technology related decisions, and advocate for safe, ethical, and patient centered digital healthcare. Digital empowerment means that nurses should not be passive recipients of new systems. It means they should be involved in the design, selection, testing, implementation, and evaluation of the digital technologies. The International Council of Nurses emphasizes that nurses must participate in monitoring and evaluating emerging digital health technologies to ensure that these tools, these new technologies, positively contribute to the health system, contribute to the workforce process, and also contribute to the patient needs. This is important because digital tools can either empower or burden nurses. For example, electronic health record can improve the continuity of care, but poorly designed electronic health record can increase the documentation workload on nurses. Another example, AI. AI can support clinical decision making, but unsafe or biased AI may create new risks. So, therefore, empowerment requires both competence and voice. Nurses need the skill to use technology and also need authority to question, improve, and lead digital practice. The digital transformation in healthcare system. There are many examples of that. Digital transformation refers to the integration of digital technologies into healthcare delivery, into education, management, and research. WHO in 2021 identifies that digital health as a global priority to improve healthcare access, improve quality of care, and system efficiency. It involves changing not only the tool used in healthcare, but also the way care is organized, the way by which care is documented, also communicated and evaluated. And here are some examples of the digital transformation in healthcare system, like electronic health record. Electronic health record allow patient information to be stored, shared, updated, and accessed across healthcare setting. For nurses, electronic health record support documentation, support medication safety, care planning, discharge planning, and communication between the professionals. However, effective use of electronic record depends on the training and system usability, data accuracy, and confidentiality. Another example of the digital transformation in healthcare system is telehealth and remote care. Telehealth allow patients to receive consultation, follow-up, education, and monitoring without being physically present in healthcare facility, right? Yes, this is particularly useful for patients in rural areas, patients with chronic diseases, and those patients requiring regular follow-up. Here, nurses can play a major role in telehealth by assessing symptoms, educating patients, monitoring adherence, and identifying when escalation of the care is needed. Also, another example is the wearable device and remote monitoring. Wearable device can monitor heart rate, oxygen saturation, sleeping pattern, glucose level, physical activity, and many other health indicators. These technologies, the wearable devices, can support the preventive care and early detection of deterioration. Here, nurses need to understand how to interpret this data and how these devices can be used and respond appropriately. Another example of digital transformation is big data and predictive analytic. Healthcare systems generate large amount of data from patient record, from laboratory results, imaging, monitoring devices, and administrative system. All of this big data should be analyzed appropriately. This data can help to identify the pattern, predict the risk, improve quality, support the decision making. Nurses need data literacy to understand what the data mean, what its limitations are, and how it should be used ethically, how we can use this big number of data. WHO Global Strategy in Digital Health highlights that digital health initiatives require organizational, financial, human, technological resources. This means what? This means that digital transformation is not only about buying technology. Digital transformation means workforce preparation and strong governance. Artificial intelligence in nursing practice. Artificial intelligence refers to computer system that can perform tasks usually associated with human intelligence, such as recognizing a pattern, making predictions, interpreting data, generating responses. In healthcare, AI, artificial intelligence, can support diagnosis, support risk prediction, documentation, clinical decision, patient education, and workflow management. And here are several ways in nursing practice using AI, like clinical decision support. Artificial intelligence can help identify patient at risk of deterioration, identifying the patient risk for falls, sepsis, pressure injuries, and risk for readmission or risk for medication-related complication. For example, AI system may analyze vital signs and laboratory values, nursing notes, all previous medical history of the patient to alert staff that a patient may need urgent review. However, AI should support nursing judgment, not replace nursing judgment. Nurses must remain responsible for assessing the patient holistically, considering context and questioning alerts that don't match the clinical picture. This is the responsibility of the nurse. Another example is a predictive analytic. Predictive analytic can help healthcare team identify future risk before they become serious. For example, AI may help predict which patients are at higher risk of developing brachial ulcers or which patients are likely to require intensive care. This can support early intervention and better resource of allocation. Also, another example of how we can use AI in nursing practice, AI assisted documentation. AI tools may help summarize the clinical notes, structure documentation, reduce repetitive administrative tasks. This has a potential to reduce workload, but it also raises concerns about the accuracy, confidentiality, and professional accountability. So nurses should be aware of this side when using AI tools. Another example is robotic and smart technologies. Robots may assist with medication delivery, patient lifting, disinfection, rehabilitation, companionship in some setting. These technologies may reduce the physical workload on nurses improve the efficiency, but also they cannot replace the rational, emotional, ethical dimension of nursing care. And all of these dimensions are so important when caring for our patients. Also, generative AI in healthcare. Generative AI include large multimodal models, can process text, images, audio, other data formats. According to WHO 2025 guidance notes, that these systems may have wide application in healthcare. Also can be used in research, public health, drug development, but they also require careful governance because the risk related to accuracy or bias or privacy or misuse is major. Here, the key message for nurses is that AI, artificial intelligence, should be viewed as an assistant, not an authority. Nurses need to understand its strengths, limitation, and risk when using AI tools. The digital competencies for future nurses. If we are talking about the empowerment of nurses, we should talk about the required competencies for the future nurses. Future ready nurses need more than basic computer skills. They require a broader set of digital competencies that allow them to practice safely and confidently in a technology rich environment. And here some important competencies. First competency is a digital literacy. Digital literacy mean what? Mean the ability of the nurse to use digital tools. This use must be safely, efficiently, and appropriately. This include navigating electronic record, using a clinical system, assessing online guidelines, and communicating through digital platforms. The other competency is data literacy. Data literacy mean how the nurse understand how the data is collected, how the data is interpreted, and how the data is used. Nurses should understand that data quality matters. It is so important. Incomplete or inaccurate or biased documentation can lead to unsafe clinical decision, especially when we are using AI system and this system are really on that data. Another competency is AI literacy, which means that we are as a nurse should understand what AI can do and what AI cannot do. Nurses should know that AI outputs are not always correct, that algorithm may reflect bias, and that clinical judgment remain essential. Recent nursing literature increasingly highlight AI literacy as a necessary skill for nurses to participate confidently in AI-enabled healthcare. Another competency which is cybersecurity awareness. Nurses handle sensitive patient information every day. Therefore, they need awareness of the password protection, phishing risk, secure communication, device security, and confidentiality. The critical thinking in digital practice. It is another and important competence should be available for the ready future. To be ready for future. Future nurses must be able to ask a critical question. Is this digital recommendation clinically appropriate? I have to ask myself, if I am using AI, is this digital recommendation clinically appropriate? Is the data complete? Could the system be wrong? Does the technology improve care or create more workload? Is the patient comfortable with this digital approach? And this also another important from the patient right, if the patient comfortable or not with using digital approaches. This means digital competence must therefore be connected to the professional judgment, to the professional ethics and patient advocacy. It is an important issue also. Regarding the nursing education, if we prepare the nurse for future, we have to apply innovative approaches in nursing education for future. Nursing education must prepare students for healthcare system that is increasingly digital, data-driven, technologically complex. And now traditional teaching alone is no longer sufficient. If we rely on traditional teaching alone in this era, it is not sufficient. One of the innovative approaches in nursing education is a simulation-based learning. Simulation allows a student to practice clinical decision making in a safe environment, and this is important, safe environment, to gain the trust, confidence in their practices in a safe environment. High fidelity simulation, virtual patient, AI supported scenarios can help students develop assessment skills, prioritization, and communication skills, also teamwork. Virtual reality and augmented reality, also another innovative approach in nursing education, as virtual reality can immerse students in a realistic clinical situation, such as emergency care, infection control, mental health scenarios. While augmented reality can overlaying digital information onto real world setting, help the learner to visualize the anatomy, procedure, or clinical processes. Another innovative approach in nursing practice is the e-learning and blended learning. Digital platforms allow flexible access to the learning materials, recorded lectures, quizzes, interactive activities. Blended learning combine both online education and face-to-face teaching, allowing the student to prepare themselves before class and apply knowledge during practical sessions. Also, another innovative approach is AI in nursing education. AI can support personalized learning, automated feedback, adaptive quizzes, clinical reasoning exercises, and intelligent tutoring. However, nursing program must teach students how to use AI responsibly. National Council of State Board of Nursing has highlighted the importance of preparing educators, preparing regulators, preparing healthcare leaders to respond to the AI related changes in nursing education and in nursing practice. Another approach is educating nurses to be innovators, educating nurses as innovators. Future nursing education should not only teach students how to use technology, it should teach them how to identify problems, propose solutions, evaluate innovations, and participate in quality improvement and research. Nurses should graduate as safe practitioners, critical thinkers, contributors to healthcare innovation. Now we will shift to the barriers. What are the barriers to the digital empowerment? Despite the opportunity created by digital health, many barriers can limit nurses' digital empowerment. One of these barriers is lack of training. One of the most common barriers is insufficient training. Nurses may be expected to use new system without adequate preparation, which can increase the stress and reduce the confidence. Nurses must be prepared and trained to use digital tools. Resistance to change, it is another barrier. Some nurses may resist digital technologies. Why? Because they fear increased load or loss of human connection with their patients or being replaced by technology. They have some fears to lose the communication with the patients or may be replaced by the advanced tools. This resistance is often not caused by lack of willing, but by lack of involvement, poor communication with nurses, previous negative experiences with technology. Another barrier is the workload and the time pressure. Busy clinical environment can make it difficult for nurses to learn a new system. If digital tools are poorly designed, they may increase documentation time and reduce time with patients. Another barrier is the unequal access to technology. Not all healthcare settings have the same level of digital infrastructure. Some nurses may work in environment with limited internet access, with outdated system, or inadequate technical support. Another barrier is the poor system design. If the system are not designed with nurses' workflow in mind, they can become frustrating and unsafe. Nurses must be involved in the design, involved in the evaluation, because they understand the realities of the bedside care. And the last barrier, fear of accountability. Nurses may be unsure who is responsible when AI gave incorrect recommendation. This creates an anxiety about professional accountability and legal responsibility. If the AI tool gave us incorrect recommendation, who is responsible? Me as a nurse? This creates an anxiety about professional accountability and legal responsibility. So, all of this barrier shows that digital empowerment is not only an individual responsibility. Digital empowerment requires organizational support, leadership, policy, training, and inclusive implementation. Now we will shift it to the ethical and legal consideration in using digital tools. Digital healthcare raises important ethical and legal issues. Nurses must be prepared to protect patient rights in digital environment. Patient privacy and confidentiality. This is an important ethical and legal consideration while using digital healthcare services, as digital systems contain highly sensitive patient information. Nurses must ensure that information is accessed only when needed for care or when needed to be shared appropriately and protected from unauthorized access. Another consideration, which is cybersecurity. Cybersecurity is a patient safety issue. Cyber attack can disrupt healthcare services, can delay treatment, expose the patient data, and may affect the trust in healthcare system itself. Nurses must follow secure digital practices and report suspicious activities. Also, another consideration, which is algorithmic bias. AI systems are trained on data. If the data reflect existing inequalities, the AI system may produce biased result. For example, an algorithm may perform less accurately for certain groups if those groups were underrepresented in the training data. WHO warned that ethical and human rights consideration must be central to the AI design and deployment in healthcare. Another consideration, ethical and legal, which is transparency, explainability. Nurses and the patient need to understand how decisions are made. If an AI system gave a recommendation without explanation, it may be difficult to trust or challenge that recommendation. Another consideration is the human oversight. It's very important. AI should not remove human responsibility. Nurses must use AI recommendation as a part of a broader clinical judgment process. Human oversight is essential to ensure safety, compassion, and accountability. Another important ethical and legal consideration is the informed consent. Patients should understand when digital tools or AI systems are being used in their care, especially when these tools influence the assessment, diagnosis, treatment, or monitoring. WHO identify ethical governance as essential for AI in health and recommend the principles such as protecting autonomy, promoting safety, ensuring transparency, supporting responsibility, promoting equity, and ensure sustainability. What are strategies to empower nurses in digital era? To prepare nurse for future, healthcare organization and educational institution need clear strategies, right? Right. Provide continuous digital education is one strategy. Digital skills should be part of undergraduate nursing education and be part of postgraduate training and be part of the continuing professional development. Training should be practical, repeated, linked to the real clinical scenarios. Another strategy to empower the nurses in digital era is involving the nurse in technology decision. Nurse should be included when hospital select, design, pilot, and evaluate digital system. We must be a part. Their feedback, our feedback as a nurses, can prevent poor usability and improve patient safety also. Another strategy is develop nurse digital champion. Hospital can identify nurses who are interested in technology and train these nurses as digital champions. These nurses can support colleagues, provide peer education, and bridge the gap between clinical team and information technology department. Also, a good strategy is strength nursing leadership. Nurse leaders need to advocate for resources, for training, for safe staffing, and nurse involvement in digital transformation. International Council of Nursing state that nurses leaders play a crucial role in shaping digital health and should be supported and resourced to lead digital transformation for nursing workforce. Another strategy is promote interprofessional collaboration. Digital transformation require collaboration between nurses, physicians, pharmacists, information technology specialists, engineers, educators, managers, and policymakers. Nurses should be visible member of these teams. These teams cannot be work without nurses. Another strategy is to create a culture of innovation. Empowered nurses should feel safe to suggest improvement, to test new ideas, to report a problem, and to participate in research and quality improvement. So, innovation should not be limited to technology experts. Innovation should include the frontline nurses who understand patient care challenges. And now, the future of nursing, vision and opportunities. The future of nursing will be shaped by interaction between human care and digital innovation. Technology will continue to influence how patients are monitored, how care is documented, how risks are predicted, how education is delivered. This is the role of technology. Okay, however, the core of nursing will remain human. Compassion, communication, advocacy, ethical judgment, cultural sensitivity. The presence cannot be replaced by technology. Our role cannot be replaced by technology. Instead, digital tools should free nurses from unnecessary burden and allow them to focus more on meaningful patient care but not replaced. The future opportunities for the nurses include many items like becoming digital health leaders, contributing to AI governance, participating in clinical technology decision, leading telehealth services, using data to improve patient safety, conducting digital health research, educating patients about digital tools, developing innovation projects in healthcare setting, all are future opportunities. In Saudi Arabia, this topic, the empowerment, is especially relevant because healthcare transformation and digital innovation are aligned with the national modernization priorities, including Saudi Vision 2030 and the development of more efficient, accessible, and technology enabled health services. To conclude this, digital transformation is changing healthcare rapidly. Artificial intelligence, electronic health record, telehealth, wearable devices, robot, and data analytic are creating new possibilities for improving patient care. But at the same time, they introduce ethical, educational, legal, and professional challenges. Here, nurses must be empowered to lead this transformation, not merely adapt to it. We need to lead this transformation, not merely adapt to use it. Empowerment requires digital competencies, ethical awareness, organizational support, leadership, involvement in decision making. So, my central message for this topic is future ready nurses are not replaced by technology, they are empowered by it. when they have the knowledge, confidence, authority, and the ethical awareness to use it wisely. Thanks so much for your attention. وآخر دعوانا أن الحمد لله رب العالمين.
Thank you, Dr. Shima, for that extensive and informative session on empowerment in nurses in digital healthcare. Thank you to all our speakers once again. On behalf of the Nurses Labs, we extend our heartfelt appreciation for your valuable contribution as a speaker for the International Nurses Day 2026 themed webinar. Your insightful session, professional expertise, and inspiring thoughts added great value to the event and enriched the learning experience of all the participants. Your contribution has helped us celebrate the theme, Our Nurses, Our Future, Empowered Nurses Save Lives. We sincerely thank you for sharing your knowledge, time, and commitment towards nursing education, professional development, and global nursing excellence. We will now move on to the award ceremony, and we will now announce the much-awaited results for our International Nurses Day competitions that was held throughout the last week of April and the first week of May. We will now also be unveiling the Nurses Day theme song for this year's International Nurses Day from Nurseslabs.
In the quiet of the morning, when the world begins to rise, there are hands that bring the healing. There is hope in caring eyes. Through the storms and through the silence, through the pain and through the fear, nurses stand with strength and kindness, bringing comfort, drawing near. Every step, every touch, every life you help renew, every heart that feels your courage, we are here to honor you. You are the heart of care, the light that leads the way. With compassion, strength, and courage, you bring hope to every day. You are the hands that heal, the voices brave and true. Tonight the world is standing proud to celebrate you. From the bedside to the front lines, from the classroom to the call, you are leaders, you are heroes, you give meaning to it all. Across nations, across cultures, one profession, one bright flame. Nurses lifting lives with purpose, changing futures in your name. Every dream, every fight, every promise you pursue, every patient, every family feels the difference made by you. You are the heart of care, the light that leads the way. With compassion, strength, and courage, you bring hope to every day. You are the hands that heal, for care, for life renewed. This night belongs to you.
We will now have the much awaited results for our Nurses Day competitions that were held from the last week of April and the first week of May. I kindly request the technical team to kindly play the video and to announce the results for this competitions.
Good evening and a warm welcome to the Nurseslab International Nurses Day Award Ceremony. Today, we gather to honor the heart of healthcare, our nurses. Over the past few weeks, many talented participants have actively presented their work in various competitions, sharing their ideas, evidence, creativity, and professional excellence. Each presentation reflected commitment, confidence, and a strong desire to contribute to nursing education, patient care, and healthcare improvement. This award ceremony is dedicated to recognizing those outstanding participants who have been carefully evaluated and selected as winners for their excellent performance, meaningful presentations, and valuable contributions. Tonight, we proudly celebrate the winners of our competitions, including Nurse-led Research and Evidence-Based Practice Competition, Scientific E-Poster Competition, Digital Storytelling Reels Competition, and other special nursing excellence recognitions. These awards are not only a symbol of achievement, but also a recognition of dedication, hard work, professional growth, and the power of nurses to lead positive change. On this special occasion of International Nurses Day, Nurseslab proudly recognizes the outstanding contributions of nurses who inspire change, strengthen healthcare, and make a lasting difference in the lives of patients and families. Let us begin the Nurseslab International Nurses Day Awards Ceremony with pride, gratitude, and honor. Together, empowering nurses and enhancing care. First, let us begin with the Nurse-led Research presentation winners. Over the past weeks, our participants presented excellent research ideas, evidence-based concepts that reflect the growing leadership role of nurses in healthcare improvement. Each presentation was evaluated for its relevance, clarity, scientific value, nursing impact, and contribution to patient care and professional practice. Now it is our honor to announce the winners of the Nurse-led Research Presentation Competition Professional category. First prize winner is Mr. Debagioti Paul. He is a nurse practitioner in critical care by profession, currently working in NH Hospital, Bengaluru. Thank you, sir. Your outstanding presentation, strong research focus, and valuable contribution to nursing practice truly deserve this recognition. Congratulations on this remarkable achievement and winning the first prize. Second prize winner is Dr. Sashikala D. She is a professor currently working in Apollo College of Nursing, Chennai. Thank you, ma'am. Your presentation reflected excellent effort, professional commitment, and a meaningful approach towards evidence-based nursing care. Congratulations on this remarkable achievement and winning the second prize. Third prize winner is Mr. Vijay R. He is a nursing tutor in Indira Gandhi Medical College and Research, Pondicherry. Thank you, sir. Your work demonstrated creativity, knowledge, and a strong passion for nursing research and practice improvement. Congratulations on this remarkable achievement and winning the third prize. Next, it is our honor to announce the winners of the Nurse-led Research Presentation Competition Student category. First prize winner, Ms. Varsha Alawat. She's a Master's of Science in Nursing student currently studying in AIMS, Raipur. Thank you, Ms. Varsha. Your outstanding presentation, strong research focus, and valuable contribution to nursing practice truly deserve this recognition. Congratulations on this remarkable achievement and winning the first prize. Second prize winner, Ms. Vanshika M. Munda. She's a diploma nursing student currently studying in College of Nursing Herbert Christian Hospital, Uttarakhand. Thank you, Ms. Vanshika. Your presentation reflected excellent effort, professional commitment, and a meaningful approach towards evidence-based nursing care. Congratulations on this remarkable achievement and winning the second prize. Next, let us move on to the scientific e-poster presentation winners. The scientific e-poster competition provided participants with a platform to present their scientific ideas, research findings, clinical concepts, and evidence-based practices in a creative and visually effective manner. Each poster reflected knowledge, clarity, originality, professional presentation, and relevance to nursing practice and patient care. Now, it is our pleasure to announce the winners of the Scientific e-Poster Presentation Competition Professional category. First prize winner, Mr. Rinju Francis. He is an infection control nurse by profession and currently working in Health World Hospital's Durgapur, Dugana. Thank you, sir. Your poster demonstrated excellent scientific content, clear presentation, and strong relevance to nursing practice. Congratulations on this outstanding achievement and winning the first prize. Second prize winner, Professor Shilpa J. She is working as Vice Principal in School of Nursing, Arka Jain University, Jharkhand. Thank you, ma'am. Your e-poster reflected meaningful effort, good organization, and a strong evidence-based approach. Congratulations on this outstanding achievement and winning the second prize. Now, it is our pleasure to announce the winners of the Scientific e-Poster Presentation Competition, Student category. First prize winner, Ms. Sanika Vital Thambre. She is a first-year BSc nursing student and currently studying at Sadhu Vaswani College of Nursing, Maharashtra. Thank you, Ms. Sanika. Your poster demonstrated excellent scientific content, clear presentation, and strong relevance to nursing practice. Congratulations on this outstanding achievement and winning the first prize. Second prize winner, Ms. Arthi. She is a BSc nursing student and currently studying at the College of Nursing Indira Gandhi Medical College and Research, Pondicherry. Thank you, Ms. Arthi. Your e-poster reflected meaningful effort, good organization, and a strong evidence-based approach. Congratulations on this outstanding achievement and winning the second prize. Third prize winner, Ms. Saina Sharing. She is a third-year diploma nursing student currently studying at the College of Nursing, Herbert Christian Hospital, Uttarakhand. Thank you, Ms. Saina. Your poster showed creativity, knowledge, and dedication toward professional nursing excellence. Congratulations on this outstanding achievement and winning the third prize. Now it's time to see the winners of the Digital Storytelling Reels competition. This competition celebrated creativity, communication, and the power of digital media in nursing. Over the past weeks, participants presented meaningful reels that reflected nursing values, healthcare awareness, patient care, education, compassion, and professional excellence. Each reel was evaluated for creativity, clarity of message, relevance to nursing, presentation style, impact, and overall engagement. Now, it is our pleasure to announce the winners of the Digital Storytelling Reels competition, Professional category. First prize winner, Mr. Bala Bharathi Bhaskar. He is a critical care nurse and currently working in Health Assurance Hospital, Kuwait. Thank you, sir. Your reel was highly creative, impactful, and beautifully presented. It delivered a strong message with clarity and inspiration. Congratulations on this outstanding achievement and winning the first prize. Second prize winner, Ms. Swati Upreti. She is a nursing tutor, currently in Meet Kuman College of Nursing, Haldwani. Thank you, ma'am. Your reel reflected excellent effort, creativity, and a meaningful approach to nursing communication through digital storytelling. Congratulations on this outstanding achievement and winning the second prize. Third prize winner, Mrs. Sneha. She is an ICU nurse and currently working in Adan Hospitals, Kuwait. Thank you, ma'am. Your reel demonstrated originality, dedication, and a powerful message that connects with the spirit of nursing and care. Congratulations on this outstanding achievement and winning the third prize. Next, it is our pleasure to announce the winners of the Digital Storytelling Reels Competition Student category. First prize winner, Miss Arthi S. She is a BSc nursing student and currently studying in College of Nursing, Indira Gandhi Medical College and Research Institute, Pondicherry. Thank you, Miss Arthi. Your reel was highly creative, impactful, and beautifully presented. It delivered a strong message with clarity and inspiration. Congratulations on this outstanding achievement and winning the first prize. Second prize winner, Miss Rishika Soni. She is a BSc nursing student, currently studying in Jabalpur Institute of Nursing, Madhya Pradesh. Thank you, Miss Rishika. Your reel reflected excellent effort, creativity, and a meaningful approach to nursing communication through digital storytelling. Congratulations on this outstanding achievement and winning the second prize. Next, let us move on to the much-awaited prestigious Nurseslab Annual Awards. The Nurseslab Annual Awards recognize outstanding nurses and nursing professionals who have demonstrated excellence, dedication, leadership, innovation, and meaningful contribution to the nursing profession. These awards were selected through a nomination process where deserving candidates were nominated based on their achievements, professional service, impact in nursing practice, contribution to education, leadership qualities, and commitment to improving healthcare. Each nomination was carefully reviewed, and the selected awardees truly represent the values of compassion, excellence, service, and professional leadership. Now it is our honor to announce the winners of the Nurseslab Annual Awards under 4 special categories. We will announce each category, followed by congratulating the selected award winner. Category 1, Nurse of the Year Award. Criteria: this award recognizes an outstanding nurse who has demonstrated exceptional dedication, compassion, clinical excellence, professionalism, and commitment to quality patient care. This award winner, who goes beyond routine responsibility, supports patients and families with empathy, inspires colleagues, and reflects the true values of the nursing profession. Our winner from many nominees is Mrs. Ambuswari. To know about her, she did her MSc in nursing and currently working as a staff nurse cum ANQAS, National Quality Assurance Standard, Government Headquarters Hospital, Hosur, Tamil Nadu. Congratulations to the winner of the Nurse of the Year Award. Nurseslab thanks and honor your compassionate service, professional excellence, and dedication to patient care, which are truly inspirational. Nurseslab proudly honor your remarkable contribution and congratulate you on this well-deserved recognition. Category 2, Best Nurse Educator Award. Criteria: the Nurse Educator Award honors a dedicated nursing educator who has contributed significantly to teaching, mentoring, academic excellence, and shaping the future generation of nurses. Our winner from many nominees is Mrs. Jebapakiam D. To know about her, she did her MSc in nursing and currently working as a senior clinical nurse lead specialist, Apollo Main Hospitals, Chennai, Tamil Nadu. Congratulations to the winner of the Nurse Educator Award. Nurseslab thanks and honor your dedication to nursing education, and your role in guiding future nurses are deeply appreciated. Nurseslab sincerely congratulate you on this meaningful achievement. Category 3, Nursing Leadership Award. Criteria: the Nursing Leadership Award recognizes a nurse leader who has shown exceptional leadership, professional guidance, team motivation, and contribution to the growth and development of nursing practice. Our winner from many nominees is Professor Shilpa J. To know about her, she did her MSc in nursing, Professor cum Vice Principal, School of Nursing, Arka Jain University, Jamshedpur, Jharkhand. Congratulations to the winner of the Nursing Leadership Award. Nurseslab thanks and honor your leadership, vision, and commitment to empowering nurses are truly inspirational. Nurseslab proudly honor your achievement and congratulate you on this well-deserved recognition. Category 4, Excellence in Patient Care Award. The Excellence in Patient Care Award recognizes a nurse who has demonstrated outstanding compassion, clinical excellence, patient advocacy, and commitment to safe and quality care. Our winner from many nominees is Mrs. M. Pallavi. To know about her, she did her MSc in nursing and currently working as nursing officer, Government General Hospital, Kakinada, East Godavari District, Andhra Pradesh. Congratulations to the winner of the Excellence in Patient Care Award. Nurseslab thanks and honor your compassionate service, clinical dedication, and patient-centered approach truly reflect the heart of nursing. Nurseslab proudly celebrate your remarkable contribution. Next, we move on to a very special segment of the Nurseslab International Nursesday Award ceremony, honoring the respected evaluators, organizers, and hosts who contributed to the success of our competitions and events. Behind every successful competition, there is a dedicated team of experts who guide, evaluate, organize, and support every step with professionalism and commitment. Nurseslab proudly acknowledges their valuable contribution. First, Nurseslab is honored to recognize the evaluators of the competitions. Evaluator Award for Nurse-Led Research Presentation, Professional Category. This award recognition is to Dr. Jayasuda, Principal, DMC and H College of Nursing, Ludhiana. She is a senior nursing academician with over 32 years of experience in teaching, research, and many publications, and academic leadership. Nurseslab thanks and honor your dedication, expert review, and commitment to encouraging research and scientific presentation among nurses are deeply appreciated. Congratulations and thank you for your valuable contribution. Evaluator Award for Scientific E-Poster Presentation, Professional Category, and Nurse-Led Research Presentation, Student Category. This award recognition is to Dr. Rajathi Saktivel, Vice Principal and HOD Child Health Nursing, Hindu Mission College of Nursing, Chennai. She has over 20 years of clinical and academic experience with 70+ indexed publications, multiple research awards, and national and international paper presentation recognitions. Nurseslab thanks and honor your dedication, expert review, and commitment to encouraging research and scientific presentation among nurses are deeply appreciated. Congratulations and thank you for your meaningful contribution. Evaluator Award for Scientific E-Poster Presentation, Student Category. This award recognition is to Dr. Madhu Sheila, Vice Principal, Narayana Hridayalaya College of Nursing, Bangalore. She has over 18 years of nursing education, with strong contributions in teaching, workshops, research guidance, student learning, and professional development. Nurseslab thanks and honor. Your guidance and evaluation helped encourage young nursing minds to present their ideas with confidence, clarity, and scientific value. Congratulations and thank you for your dedicated support. Nurselab Best Host and Organizer Award 2026. Congratulations, Ms. Tanya McGregor. Nurselab thank and honor your dedication, professionalism, and contribution to Nurselab's educational events are truly appreciated. Thank you for helping make every event meaningful, organized, and successful. Now it's time to thanks and honor the event organizers. Nurseslab would now like to express our heartfelt gratitude to Dr. Bhuvaneshwari Kanagaraj, who was behind the success of this event. Her dedicated efforts in organizing the events, preparing the competition guidelines, developing the evaluation criteria, coordinating requirements, and supporting the smooth conduct of the competitions have been truly remarkable. Nurseslab sincerely thanks and honors Dr. Bhuvaneshwari Kanagaraj for her outstanding contribution, leadership, and commitment in making this event successful. Congratulations and thank you for your exceptional contribution behind the scene. Nurseslab would also like to thank and honor Miss Tanya and Mrs. Anita for their valuable contribution in hosting the event and supporting the competitions. Your presence, coordination, communication, and professional hosting added grace, structure, and energy to the event. Nurseslab proudly appreciates your contribution and thanks you for being an important part of this celebration. Congratulations and thank you. Nurseslab would also like to express our sincere gratitude to our valued sponsor, Website Chat, from Expressair Technologies India Private Limited. We deeply appreciate your wonderful contribution in creating the beautiful theme song for this year's International Nurses Day.
A hearty congratulations to all the winners and award nominees and recipients for this year's International Nurses Day 2026 from Nurseslabs. A heartfelt gratitude to all the organizers, contributors, and sponsors for these events. Thank you to all the participants for their participation and the evaluators for the competitions, not forgetting all the people working in the background to make this event a successful one. Once again, thank you and have a good evening.